standing in the kitchen and answered the phone, and that was that. I was a little shocked, but like I said, I sort of knew. I knew something was up with my body.
I guess I just hoped for the best. You don't think of anybody getting cancer in their early to mid-40s. What was going through my mind when I heard it was, well, this can't be happening to us.
When a patient is diagnosed with cervical cancer, the entire process is amazingly uncomfortable, invasive, and disruptive to women's lives, where patients really suffer. They suffer in terms of physical pain, they suffer in terms of emotional stress and anxiety, and they suffer because their families are suffering.
It's an entirely preventable cancer. Even here in Canada, 400 to 500 women each year die from cervical cancer. The World Health Organization has stated that cervical cancer is one of the gravest threats to women's lives in the world.
The kids knew something was up. At that point, I think Tessa and Kate were probably 4 and 5 years old.
We were just very upfront about what I'm sick. It was difficult. The biggest worry for me is that I'm going to leave my children. Because they need a mom.
Even though I knew what was happening, it didn't seem like it could be happening still to us. She chose the, I don't know if you want to say the safer or the more invasive surgery to try to remove as much as possible to try to make sure all the cancer was removed.
The lesion that I had on my cervix was quite large. I wanted to just get it out of my body. Probably was most nervous about it spreading. I just wanted to take the risk away.
I remember when they rolled her away, I was really scared, but she was a trooper. And I wasn't thinking about what would happen if things didn't work out. And that wasn't an option. You just don't think that way. I mean, you just can't. You can't face it that way. So you remain strong and stay there to support your partner. That's what I tried to do. We were going to get through it.
When I was in the hospital, I have to say, I did think, I don't think I can do this. I don't think I can do this. This is hard.
You don't want to see ever your partner in that much pain. And you can't do anything about it. It's a very, very scary process, and we were lucky to get through it the way we did.
I don't think that women realize how common this cancer is.
It's the third leading cause of cancer in women who are 25 to 45. Now think about those women. Those are women who are mothers, they are partners, they are wives, they are daughters, they are community leaders. Cervical cancer is a cancer that's caused by an infection. It's called the human papillomavirus. 80% of women at some point in their lifetime will be infected with the HPV virus. This infection doesn't discriminate. This is an infection that impacts all women, and that means that all women potentially are at risk for developing cervical cancer. My goal is to eradicate cervical cancer from British Columbia and ultimately to use the lessons learned from our experience in British Columbia to eradicate cervical cancer globally.
We could eliminate this disease. We have been in this province at the forefront of innovation around cervical cancer. In 1949, British Columbia was the first district to introduce a fully funded pap smear screening program. And we modeled care that has changed the world. We have the potential to lead that kind of change again. BC Women's Hospital is integral to this kind of program.
We have two ways of preventing cervical cancer. The first and the best way is with the HPV vaccine. We actually have a vaccine that prevents cancer. It's quite remarkable. It's quite astonishing, and it's quite a miracle. Even with all of that, we still have only about a 65 to 70% uptake rate of the vaccine. BC has already led the world in looking at reducing the dosing schedule of the HPV vaccine from 3 doses to 2 doses. And can you imagine if we could go to 1 dose, what we could do in terms of improving coverage? That would be a game changer for women across the globe. To implement technology and to change that technology costs money in and of itself.
This is a part of it.
Beautiful.
Getting my daughters as soon as they're ready to be treated with the HPV vaccine, and I tell all my friends that have daughters that this is what happened to me, and it doesn't have to happen to anybody ever again.
The fact that my daughters will hopefully never have to go through this it's a huge relief.
Anything that we can do, in my mind, anything that I can do to make sure that women have healthy lives that allow them to live their lives to the fullest and thus support their children and their spouses and their communities, that's what I want to do. And that's an important part of what drives me to focus on this goal of eradication of cervical cancer.